Hello, everyone. My name is Jalen Jones, digital producer here at WRAL. Josh Stein signed an executive order to improve behavioral health care and public safety in North Carolina. If you're watching this video, like it, subscribe. If you're listening to this on podcast, please rate us, review us. We'd love to hear from you. I had the amazing pleasure of interviewing Will Doran of the NC Capitol team here at WRAL on this executive order. Here's what he had to say.
Recently, there have been several tragic instances in North Carolina where people experiencing serious mental health crisis had a terrible, horrific consequence, whether it was in Charlotte on a train or in Southport at a restaurant or here in Raleigh in someone's own home. Our hearts break for the families and friends who lost a loved one. Of course, the vast majority of people with mental health challenges don't pose any risk. They don't pose risk to others. They may not even pose risks to themselves, although sometimes they do. However, a small minority of people who are experiencing paranoid delusions can pose a risk to public safety when their serious mental illness goes untreated.
Will, first of all, how are you doing today?
I'm doing great. How are you doing, Jalen?
You know what? I cannot complain. It is Friday. Hopefully I'm not dating this, but we're having a discussion. Governor Josh Stein has signed a new executive order. What is that executive order?
Well, this executive order actually does quite a few different things, but the main point of it is to help improve the state's mental health care offering. Stein admits that the state is not doing a good enough job at getting people the health they need. Part of that is due to funding, which the governor really has no power to fix. You know, funding is completely up to either the federal government or the state legislature. That's just something the governor, just because the way the Constitution works, can't touch. But he is in charge of a lot of the state agencies, and so he can direct them to do things differently. Mm-hmm. And so that's what this executive order is it's saying, hey, Department of Public Safety, hey, prison system, hey, Department of Health and Human Services, I need you to change up the ways that you interact with each other to be more strategic. That's really the key element of this executive order, is saying we need more thoughtfulness going into how we deal with people who are in crisis and how we all interact with each other, these agencies, because, you know, the mental health hospitals are run by DHHS, but, you know, a lot of police report to DPS, and, you know, then there's also, you know, you have your adult prison system, and then you also have, you know, the youth detention centers as well for young people. And those are all different parts of state government. So the goal really is to get all of these different parts of government just talking to each other better. And, you know, for instance, when people are in a mental health crisis, something they can do is call 988. Instead of 911, they can call 988. That's the crisis intervention line.
Okay.
But sometimes 911 operators know to redirect people to 988. Sometimes they don't. And, you know, every single 911 operation is run by the individual counties. You know, so we have 100 different counties running all of this thing. So they might have different rules. And so part of his executive order is telling, you know, all the counties and local governments, hey, y'all need to be aware that 988 exists and need some more training on when it's appropriate to take people who are trying to call 911, but they don't actually need police intervention. They need mental health care intervention and send them to this new line. So that's just one example. But the executive order, to answer your question, does a whole lot of different things.
Wow. So this is basically to clean up the bureaucratic, the administration aspect of this massive problem. So this is a really good first step. Am I right?
Yeah. You know, it's at least a step.
It's a step.
I wouldn't say it's the first step, because what we saw actually was the legislature really took the first step in some of these talks we've been having. You know, people will remember it was last summer, Irina Zarutska. She was a Ukrainian immigrant in Charlotte who was stabbed to death on the train there. It appears to be, at least according to the police, just a completely random killing by someone who they say was homeless, had a long history of mental illness.
Okay.
And there have been several other killings like that. You know, we had the Zoe Welsh killing here in Raleigh, a kind of similar situation. Police say it was a homeless person with a history of mental issues. There was a mass shooting in Southport down on the coast near Wilmington that Stein also referenced in his speech announcing this executive order that police say was committed by a military veteran who may have been undergoing some sort of mental issue and shot up a restaurant down there. And so, you know, he pointed at these things and says, you know, look, here's an example of why we need to change. But after that Irina Zarutska killing in Charlotte, the state legislature came in and they passed what's called Irina's Law, and it does have some changes. It brings back the death penalty. It ends cash bail, which both of those things, they're not going to prevent crime. They're aimed at, having a more tough on crime reaction to things, but they don't really do anything to address the root causes. And Stein says, okay, I'll sign Irina's Law into effect. I acknowledge that we do need to, have some of these harsher penalties. But he was very critical of the state legislature for not putting any extra funding into mental health care, not putting any extra funding into law enforcement, and not really doing anything to try to say, okay, how are we actually going to stop these crimes from happening and stop people who might be having delusions of some sort or just a mental break from actually committing crimes in the first place. And so that's where he thinks that he can come in with this executive order and try to improve upon what the state legislature kind of kicked off with Irina's Law.
Okay, this is very interesting as well. I want to take a look at the politics of it all. Why doesn't the governor have that power to implement things the way he would want to in North Carolina? I know North Carolina is a very legislative-heavy state. Am I correct?
You are correct, yes.
Let's talk a little bit about the politics of there and why he had to go and put an executive order to kind of get his input in there.
Yes. Now, historically, North Carolina's governor is one of the weakest governor's offices in the entire country.
Okay.
And what we've seen over the last decade or so, ever since it was first Roy Cooper and then Josh Stein, both Democrats, the Republican-led legislature has just consistently, year after year, weakened the governor's office even further. So just chipping away constantly. And so now, that's not to say the governor has zero power, but it was always one of the weakest ones, and it's become even weaker in the last decade. And so, but the governor still has the power of the bully pulpit, right? He can get us talking about things because he can have press conferences and say, this is a huge priority for me, and, I'm going to put some pressure on the legislature. Governor Stein has political capital. 55% of the state voted for him to be the governor. It was one of the biggest margins of victory that we'd seen in years in the 2024 governor's race. There were Republicans who wanted him to be governor. And so he does have some of that leverage to put some pressure on the legislature, even though they're from different parties, and say, hey, I think that the legislature is dropping the ball in, X, Y, and Z ways. And here are some solutions that I am proposing. I hope that they work with me on this. And so that's what he did. And so I reached out to the legislative leaders. We didn't hear anything back from Senate Leader Phil Berger.
Okay.
Speaker Destin Hall said, we're already working on some of these things ourselves, and it's nice that the governor has some ideas, and we'll see how things go. So very non-committal. But, we did see there were Democratic lawmakers at this event, and there were also some Republican lawmakers at this event that Stein had. And he noted that, he said he thanked the Republican members of the state legislature for being there and said, I'm glad to see that we do have bipartisan buy-in on this because, frankly, this is not really a political issue, and I don't think it's even particularly a controversial issue. I think most people who are seeing these news stories or who have just experienced the mental health system in whatever way, big or small, know that we're just not really serving people the way that we should be. In fact, something that Governor Stein referenced in his executive order was that 97 of the 100 counties in North Carolina have a shortage of mental health care access and professionals.
Wow. Okay.
In all but 3 counties, we don't have enough people providing mental health care to the people who are there.
And I can imagine those big counties include
yes,
Raleigh, Charlotte, and
Greensboro. Yep.
Yeah.
But, unless you live in one of those 3 biggest places in the state, you live somewhere that just does not have just the people, who exist to serve you. And it's the same way with the state's mental hospitals. There's a lot of talk, and it's a big focus of this executive order. It was a big focus of Irina's Law. Okay, we know that most people with mental illness are not dangerous, are not violent, but we also have to acknowledge that there are a small number who can commit just heinous acts of violence. And so
at random too.
Exactly. And that's scary, and it's something that a lot of politicians and others think that we should be able to fix. But you look at the state's mental health hospitals, and they are short on staff because it is a tough job. You work really long hours. It doesn't pay that well, and it's just draining.
Yes.
And so, a lot of times when people, need help, they get told, okay, well, we'll help you eventually, but you're going to have to either, sit in jail or just wait in a hospital ER for 2-3 weeks, a month, 2 months.
Yeah.
I mean, and we've reported on these cases before, even for, for children who are being involuntarily committed because, perhaps they've attempted suicide or just have some other really serious issue. I mean, there are times when, kids have had to just essentially live in a hospital ER waiting room or, bed back in the hospital for 2 or 3 months waiting for a bed to open up in the mental hospitals because we just don't have the capacity. We're a really fast growing state. We're bringing in all these people and we're also, diagnosing more mental illness, but we just haven't been able to keep up with the demand.
Well, I can say that this does sound like a bipartisan issue because everybody wants to feel safe.
Yes.
Everybody wants justice. We realize that there's gaps in the system, and we have to fill those gaps with better administrative outputs from all departments as well. So hopefully the lawmakers can come together on both sides and realize, hey, we have a problem. Let's try to fix it. Let's put some funding behind it so we get some long-term success to get the people the help that they really need.
Yes. And one specific idea that Stein threw out there, but again is going to need support from the legislature to pay for it to actually make it happen, is this plan of sending social workers with police officers to 911 calls that are related to mental illness. He threw out a stat that, according to his DPS secretary, about 40% of all of the 911 calls made in North Carolina are not related to a crime. They're related to someone is having a mental breakdown and somebody near them, a friend, a family member, whoever, or just someone out in public, doesn't know how to deal with it and is concerned and just calls 911 to say, hey, this thing is happening. I need help. And so, when those calls happen right now, they send some cops out and, cops get some training in what they call crisis intervention, but not a whole lot. And those situations often end up with the person being arrested. And what happens when you get arrested? You go to jail and you don't always have your meds with you. You might miss a doctor's appointment, something like that. And so the idea is if we can send social workers on these calls, we can avoid arresting people if they don't really need to be arrested.
100%.
And one, that doesn't clog up the jails and it can potentially help these people get help. And two, it also frees up the cops to go back on the street and fight actual crime. They don't just have to be in somebody's home dealing with someone who is, having a schizophrenic episode or something like that. They can kind of go there, assess that the situation is safe and say, okay, social worker, you handle this, you figure this out. I'm going to go back out because, this is a small town and we only have 10 police officers on the entire force. And we need someone to be actually patrolling the streets instead of sitting here and just, dealing with this individual situation.
That makes a lot of sense because when you call 911, hey, I need help, define help, right? Help is not always, oh, I need to get this guy in jail. No, I need help. I need support from this government services to help and fix a situation, which I totally understand. I kind of like the idea, and I'm glad we. I think as soon as we get more people in the room, we can figure out actual practical solutions.
Yeah.
With that as well. Is there any other important tidbits that we missed on this reporting?
No, I mean it's really kind of the 3-prong focus. The, okay, we need to figure out, if someone's calling 911 because they're in a mental health crisis, do we need to be diverting them into the crisis hotline at 988 instead? Do we need to have a situation where we have the money to hire more social workers to free up the police so that they don't have to deal with those situations that might not be appropriate for the police anyways? And then the much bigger and more difficult question to answer of just, okay, our mental hospitals and just our capacity, even not, outpatient too, therapy and everything like that. We just don't have enough people. We're a really fast growing state. We don't have enough people in the state-run mental hospitals. We don't have enough people in the private sector delivering mental health care. How can we fix that? How can we address the holes that we have and, get people help before it spirals and turns into violence?
Well, I have thoughts about that we'll save for another podcast and for another day.
All right, we can do a whole series.
We can because I'm just thinking of is mental health care that profitable? That's the question mark. So if it's not profitable, we need the government to step in to offer a service that people aren't going to start a business in because we are an open economy where people can start businesses and things like that, and how the government is going to supplement that gap in the industry because mental health is expensive. Mental health care hospitals require a lot of people. It needs to fix itself in the industry as well. But either which way, that's my random thought about that as well, to see how much funding can we get to fix the bigger issue.
That's a good thought.
With that as well. But either which way, thank you so much for your time.
It was great talking to you about this. I think it's a really big topic that we're going to keep hearing a ton about in state politics over the coming months.
Yes, we will. We'll be here to go back and forth about it.
Check back on YouTube. We'll be covering it again, I'm sure.
I love it. Love it. Thank you so much for your time.
Thank you.
Again, thank you so much for watching. Like this video, subscribe. If you're listening to this on podcast, rate us, review us, leave us 5 stars. We'd love to hear from you. You guys make us who we are and everything that we mean to the community. Again, thank you so much for watching, and we hope that you enjoyed this video.